All right, so this is Mrs. Black. She's 31-year-old female, 2 weeks postpartum. This morning she was found difficult to arouse, confused. Her husband called 911 and she is now here. She's been really anxious and has been having nausea, vomiting, watery diarrhea, and generous abdominal pain. Hi, Mrs. Black. My name is Emily. I'm going to be your nurse today. So Mrs. Black is unresponsive. So she responds to minimal response to painful stimuli. So I would introduce myself if she was awake, wash my hands. I would ask her husband medical history. So if she has if there was any complications with childbirth, any pre-existing health conditions, diabetes, heart, cardiac related, respiratory issues, anything pertinent. So he tells me that she has asthma, she has Graves' disease, and she has hyperlipidemia. So I would take that and make a note of that. So I would get some vitals. So I would let her know what I was doing if she was awake. But stick this on there for for oxygen. Get a blood pressure. Alright, so her blood pressure is 120/76. I'll listen to her heart. I'd listen for a minute on her apical pulse. Alright, so it looks like her pulse is 145. Her O2 stat is 89 on 4 liters nasal cannula. She is breathing 32 respirations a minute. I'll take her temperature. It looks like she has a fever of 101. So I would then do my head to toe assessment. So I would start pen light, look in her eyes. So it looks like they're red and swollen. If she was awake, I'd have her sit up and look for JVD. I'd go ahead and listen to her lungs. I'd have her take a deep breath every time I put my stethoscope down if she was awake. Listen to the back of her. And then I'll listen to her abdomen. Alright, so it does look like she has bowel sounds. Her lungs have some crackles in them. So I listen to her feel her pulses. Equal. I would have her push and pull. I'd cap refill. I'd go down to her legs, check for edema. I'd feel for her pedal pulses. I'd have her push and pull down there as well. So her heart rate is irregular and fast. So I would go make a note of all of that. At this point, a nursing action that I would take would be to monitor her airway and let the doctor know that she does have a really high heart rate. Her oxygen stat is low, and maybe request to move it from a nasal cannula to maybe a non-rebreather or something that's getting more oxygen into her. I would maybe request some labs to see maybe why that heart rate is 145, let him know of that as well. That's pretty pertinent. And then I would just monitor for infections since she's not really awake, just to make sure that she doesn't get a possible infection. The labs that I would request to order would be a urinalysis, a CBC to look for BUN creatinine, definitely white blood cells to see if there's any infection going on since she does have a fever and her heart rate's high. I would look for, sorry, my dogs are going crazy. White blood cell, sodium, potassium, especially potassium since her heart rate's so high. Maybe an EKG just to see what is possibly going on. So I would go chart those. Here's her call light. I will talk to the doctor and I will go see what he wants, okay? And then I'd ask her husband if he needed anything, if I could get him anything like that. All right, so I will be back, okay? All right, Mrs. Black, I'm back. So the doctor did order a full blood panel and EKG. So the EKG, it looks like it might be tachycardia, maybe AFib. I know you said we didn't have to interpret it, but that's what it kind of looks like if I'm reading it right. And her lab, sodium was 144, pH was 7.33, TSH was 0.1, potassium was high, it was 5.0. White blood cell was 14,000, BUN was 11, creatinine was 0.7, so on and so forth. So, I would say psychologically what's going on with her is she might be having a thyroid storm, especially with the note that her husband said that she does have hyperlipidemia as well as Graves' disease, since those kind of go hand in hand with hyperthyroidism. So at this point, I would anticipate the doctor to prescribe a beta blocker to lower that heart rate since it is 145. I think it went to 155. Yeah, it goes up to 155. So I would recommend or request a beta blocker to help lower that heart rate, and maybe an antithyroid to help like inhibit the synthesis of the thyroid hormone since she's got so much going on with the hyperlipidemia, the hyperthyroidism, and the Graves' disease, since that's kind of all put together, as well as the pregnancy 2 weeks prior. So I would go get those orders go ask for those orders, and I will go get those and come back and administer for her. So here's your call light. If you guys need anything, just let me know, okay? All right, I am back. So I would explain to Mrs. Black what's going on if she was awake. So I'll explain it to her husband to let him know what we're doing. So the doctor did order 0.45 normal saline, 4 or 5% normal saline at 100 milliliters an hour to get some fluids in her. So hopefully that'll break that fever. So I would put gloves on, and he also did order some propanol. Okay, so she is intubated now from respiratory therapy, and yeah, she's intubated, and she's got a swollen thyroid gland. So I would, assuming she already has an IV, I would stop it, disconnect it, wipe off the port with my alcohol pad, and then I would wipe off this one. I would run it through so that there's no air bubbles, and then once it gets there, I'd attach it to the other one. So we change that IV bag, and then to give this propanol, it is IV push, so it's not a poke or anything, it just goes straight through the IV port. So I would wipe that port down with an alcohol swab, make sure it's nice and clean, twist off the syringe, twist on the syringe, or take off the needle, twist on the syringe. Push that over the allotted time. Take this out. I'd put these both in the sharps container, and then I would wipe this port off again, just to make sure that it's clean. And so that new saline is running at 100 milliliters an hour, and then that medicine is 3 times a day. Oh my goodness. 3 times a day, 10 milligrams IV push. So that propanol is going to decrease her heart rate. Since it's 145, that is pretty high. And then I would also recommend an antithyroid to help inhibit the synthesis of the thyroid hormone. So my response to the husband explaining what triggered the thyroid storm would be that the thyroid storm happens for many reasons: trauma, surgery, pregnancy, incorrect medication management, infection. But I would explain to her that with that pre-existing Graves' disease and the hyperlipidemia, that hyperthyroidism, there's just so much overproduction of the thyroid hormone going on that the excess of those hormones, especially during pregnancy and the Graves' disease, just kind of overloaded her, is what I would assume. And I think that that's what would have caused the thyroid storm to act up to where she is unconscious and having that much of an issue with the hyperthyroidism. So I would explain that to him. I do some teaching on how to prevent that from happening again. And I would check on her every 4 hours, do vitals, that medication's 3 times a day. So I would come back in 30 minutes to double check that she wasn't having any adverse effects. I did forget to check her wristband and allergies and date of birth before doing that medication. So if I could rewind, I'd do that. And I do her 5 rights: right person, right dose, right time, right amount, and right drug. So I would come back every 4 hours, double check on her, and make sure everything's okay. And I leave her call light. And then I will go get the other nurse. I will trade off for her. She's going to be here for the rest of the night. And I will do report for that. All right. So this is Mrs. Black. She is a 31-year-old female, 2 weeks postpartum. She came in with nausea, vomiting, diarrhea, really anxious, was confused, kind of unresponsive. So she was brought in through the ED via ambulance. We ran a bunch of tests on her. Came in with swollen red eyes, crackles, really high heart rate, 145. Blood pressure was normal. O2 stat was 98% with 4 liters, normal saline or nasal cannula. So they did do an EKG on her. She's intubated. She gets propanol 10 milligrams 3 times a day, IV push. Tolerated well, no adverse effects or anything like that. So they did do some labs on her to see maybe what's going on. They kind of determined hyperthyroidism, thyroid storm, just from the buildup of the Graves' disease that she has already pre-existing, and the pregnancy, the hyperlipidemia, all of that. So she is still unconscious. She is minimally responsive to pain. So she has not been up and about. Other than that, I have not had any issues with her. She tolerates everything pretty well. We did change her saline bag, so that and the tubing should be okay for a couple days. Other than that, this is going to be Ashley. She'll be your nurse. You guys have a good day.